What makes Nigerians so vulnerable to narcotics? Nigeria faces one of the highest rates of drug misuse in Africa, with experts warning that illicit drugs have become a serious public health concern in the country. The nation's surge in drug use is especially blighting its young people. A 2018 UN survey found that 1 in 7 adult Nigerians had used drugs in the past year, well above the global average. Among the substances fueling the crisis is a cheap and dangerous drug known as Colorado or Kolos, which is rapidly gaining popularity among young people. DW's Funny Fashar reports from Lagos.
Getting high is quite easy in this neighborhood in Lagos. Drugs are sold on almost every street corner here, especially in places popular with young people. We are filming with a hidden camera how dealers offer various illegal drugs. Loud is a relatively expensive strain of marijuana. This small bag here goes for 25,000 naira or 15 euros. Also for sale, Kolos, a synthetic drug that mimics the effects of marijuana. It's sold in smaller sizes and is much cheaper.
So, how much is one bag? 1,000.
That's 50 cents.
Why is this different than marijuana?
Yes.
It's stronger.
Yeah,
it's stronger.
What he cannot tell our team, what exactly it's made of. Kolos is a drug cocktail that's laced with chemicals, and the makeup varies with every batch. The consequences, unpredictable.
You often see signs like this one right here, warning about the use or sale of illegal drugs. But these signs actually point to a much bigger problem, that about 14 million Nigerians struggle with drug addiction, and with those under 25 particularly at risk.
14 million people. That's the government's estimate. Many experts think the true number is much higher. Nigerian authorities say they're working hard to crack down on the sale of synthetic drugs like Kolos. But a drug dealer we will name Tunde says authorities are often involved in the business.
The police, they benefit from us because every Friday we give them money, 5,000 naira. The best of our sales go so that they don't go disturb us.
Tunde says it cuts deep into his profits. At the end of an average month, he's left with some 100 euros. Every client counts, he says, regardless of their age.
I feel bad, but due to the situation of the country, we have no choice. I need to sell more drugs to make more money.
Kolos and other synthetic drugs have become increasingly popular among Nigeria's youth. They're being glamorized on social media and even in professional music videos. No one admitted to using drugs on camera, but everyone had an explanation why people do.
Some take it because of overthinking, problems, family problems. Some take it because of depression.
1 is lack of parental care. 2, there's no job in the country. 3, there is hungry.
We show our footage of the street dealers to a drugs counselor. He quickly notices one thing.
There are younger people around watching. And they say to them, if these people can use it, my uncle uses it, my brother uses it, why can't I? And then they try, and they try, and it gets on, and then becomes more pervasive, and then it gets younger and younger.
Dokun Adedeji has been working to help Nigerians beat drug addiction for 3 decades. He's seen a lot, he says, but synthetic drugs like Kolos pose a new, much greater threat.
Many of the chemicals are heavy metals. They affect the vital organs, the kidneys, the liver, and also if it affects the brain. It takes away your ability to be a human person.
Tunde has a 6-year-old son of his own and says he would stop dealing drugs in a second if he could find another way of paying his school fees.
I learned how to do ties. I'm a stylist. There's no job in the town. That's why I get into drug business, too easy to feed my families, my siblings, and my one child.
So for now, Tunde will keep selling drugs like Kolos and perpetuate the risk that Nigeria's next generation, which his own son is a part of, will become entrapped in a dangerous cycle of drug abuse too.
Sources who work within Nigeria's Drug Law Enforcement Agency, NDLEA, have told DW that they are not aware of police taking bribes. They also said they lack the basic equipment and human resources to carry out more raids against drug networks. I'd like to now welcome Dr. Dokun Adedeji, who runs the Compassionate Care Recovery Initiative, a rehabilitation center in Lagos for substance abusers. You saw him briefly in Funny's report, and he has a lot more to share. Welcome, Dr. Adedeji.
Thank you very much for inviting me.
As someone who's treated substance abuse patients for over 3 decades, I wonder how you'd characterize either the frequency or severity of the drug abuse you've seen in the last 5 years.
I must say to you that I'm even frightened myself about the speed and the pervasiveness of what I see. Now it's almost like a daily occurrence of the people you see, and the numbers are increasing. And the challenging thing for me is the fact that the age of use is coming down. We used to see them in their upper teenage years. Now we begin to see them even at about 10-year-old. So that's, for me, is frightening. And that's the dimension of the movement that we have seen.
Who are these drug addicts you've been treating? What's the demographic? And what do they tell you about why they fell into this destructive cycle?
The thing is, the survey that was done was between 15 and 64. And I can tell you that we see that range. But for the center that I run, we try to demarcate the people we would like to see. We're seeing undergraduates who have been rusticated from the institution. We're seeing workers who have been who are tested positive in the office and they probably face a sack, and professionals as well, and workers. But I can tell you from what I have seen that the age of impact that was gotten by UNODC was about 25 to 39. But my fear, and the fear of many of us, is that the age of use is coming down. And then so now I can say there's a widespread distribution in the demography of the people we see. And some of the things they say to me are things that are peculiar to each person. Some of them say with the family background, some of them say lack of social support, family support, no psychological support. Some of them is basic ignorance, some of them are lured into it, some of them is because of peer pressure.
The data shows that the biggest drug users are young people, 25 to 39 years old, and that 1 in 4 users are women. Why do you think this group is most susceptible? And it sounds like you're saying that you're seeing shifts in the profile of users at your center.
Oh, yes. Oh, yes. You know, the thing in the center, we had a board policy that we're not going to take anybody younger than 18. So what we usually do is with those who are younger than 18, that's why we shifted our focus of advocacy for those people from secondary school, age level 10 to 18. For people from 18 and above, we can admit them. The other thing you will see is that these people are young people that are susceptible to use because of the peer pressure, the availability, the kind of this feeling of wanting to belong to a group. And also you will see that that kind of thing drives it in their age, and also the availability and also the willingness to experiment. And this is an age, maybe the teenager, upper teenager, is a year of experimentation when they choose to try what their friends have tried.
The subtext of what you're also saying is that the number of people suffering from this is really underrepresented. It's undercounted because there are many people who have not really reported their condition.
Oh, absolutely. I can tell you that for free. You know, because let me tell you, let me give an example of my country. If you use drugs, it's not something you can boast about. It's not something you can raise up and say, I do. Because of the judgmental nature of the society that we work in, people don't self-report. Not only that, because of the consequences. If you test positive, for instance, in some places, they'll sack you from your job or send you away from the institution. And so what happens? Blighted future. So people will it will be underreported. And even if you put a survey out, if they don't know the purpose of the survey, nobody will tell you they use drugs, except it becomes anonymous, and then people will say. But if this circumstance begins to change at a bit of acceptability and to get help, people will report. That's one of the things we are trying to get people to understand, to self-report, so that without consequences, you can self-report and then you can be treated and you can return to where you were coming from. And then be
You're a
accepted.
doctor. You're a doctor and not a drug enforcement agent, but I wonder whether you know about where these drugs are coming from the expensive marijuana strains to synthetic colos, and whether the government is doing anything to attack the source.
I'm telling you that Nigerian government is really doing a lot. I can say that. Because the gentleman who is in charge of our drug agency, General Marwa, he came prepared for that work. I work with him. I'm on the advisory board of the NDLEA. I'm part of his advisor. So I know that he's doing a lot. Virtually every week at the airports, seaports, and everywhere, points of entry, at borders, people are caught. So I asked him one day, I said, why do people still carry these things or traffic in it if they get caught? He said, greed. The element of greed is there because it's an extremely lucrative business. If you are not caught, you are made. So people like to take the risk. So the thing is, government, in terms of the agency, is doing a lot about that. And so in terms of interdiction, yes, it's working. But interdiction alone will not, because people are then fashioning all kinds of ways to bring it in. But you see, this drug come mainly from outside. Some of them from South America, some from the opioids come from like India or Pakistan. But the drug like fentanyl will not come straight to Nigeria. It probably will go first somewhere else, maybe to Brazil or maybe to the US, and then somebody brings in here. But I can tell you that there is no drug that is available outside that is not seen here.
What gives you hope, Doctor? Are there any promising trends, innovative approaches, or at least success stories you believe need more attention?
Oh, yes. One thing is, what gives me hope and satisfaction is the people that are helped, because they are scattered all over the world, they're in different positions and different professions. And so when they send me notice, sometimes when they send me messages, that makes me feel satisfied and pushes me on, even in spite of the difficulties. And also what gives me hope is what I think we're trying to do as a nation, though very minimal in terms of response. But I think another thing is the moment you can increase the level of advocacy and create adequate awareness, and people begin to own it and do not subject the owning to an agency or to government, then it works better. The religious bodies, the institutions, the organizations, if we all begin, even as families, begin to own the challenge, then it reduces the encumbrance that it puts on the government. I think that's where we're going, and I can see a bright light in that direction. And for some of us who worked in this space for a long time, one is encouraged by the response that one is getting.
Okay. That's Dr. Dokun Adedeji in Lagos. Many thanks, Doctor.
Thank you.